Welcome to the Convergence Play podcast.
How are you doing?
I'm good. I'm good. Thank you for
Thank.
the input. I appreciate the
So,
input.
how
So
are you doing this morning? All good?
I'm great. Yeah. How are you doing?
I'm great. I'm great. I was really looking forward to talking to you, and for one reason, two reasons, importantly. So, I do come with a extensive background in healthcare, and I really love talking about healthcare companies and healthcare organizations because in my last 20 years of my professional experience, I have helped many companies building their digital infrastructure in healthcare, EMRs, health information exchanges, social determinant of health products, and all those. So the purpose for this podcast, for which we are trying to get some time from you, is that we basically talk about the journey because I understand that technology is a relatively easy thing in what we are trying to do in healthcare domain worldwide. Technology is an easy part, but understanding awareness and creating little bit of buzz is little bit difficult, and it more important. I think awareness, understanding why digital healthcare is important, why we need to work collaboratively, and why we need to exchange data more, because I think there are a lot of challenges right now when it comes to sharing data, and it is making care a little bit difficult. So my dream is that we create a world where there is a lot of information available, and especially on digital health, and especially all those people who are trying to build applications in digital health, they should have access to your experience, your knowledge, because that thing is probably never documented. It's not available in any handbook. It is not available in any medium article, because what you might have gone through to reach where you are right now, it is going to be a unique experience. People should listen to that. They should take some inspiration from that. They should take some learning lessons, and hopefully it will help a lot of people with their own journey of making an impact. So this is the purpose of this podcast, and I really want to clarify some of the questions you might have. Of course, we will be setting up a dedicated time to talk from start, and where what are you doing, and what were your ambitions, and where you want to go, and all that. But before we have a dedicated call on that, I think this is a good opportunity for you. If you want to ask me anything, I'm more than happy to answer.
Yeah. I mean, I just kind of wanted to get a layout of exactly what is that you expect, because I want to make sure I can deliver the right information that
Thank
you're
you.
looking for. So that's really important. I understand. I've put a couple podcasts together, so I do
Yeah.
understand wanting to get the right information. I mean, what would you like to know? You can ask some questions. I'll make sure I can answer some things.
Sure. So we typically start with your background. For example, we start that, why you think this cause is that much important to you, and as I think you have been doing this for quite a while, so we will also like to understand the challenges you encountered. They may be technical challenges, they may be engineering challenges, they may be sales or business development or operational challenges. So we start with your background, your previous experience, your current affiliations with what you are doing right now, why this is important to you. So we basically want to understand your why, and then all the challenges you encountered all along the way. And then we try to understand a little bit about, because this is also one of the purposes, that we want to give people a little bit overview of technology that is being used. So we will discuss a little bit on what technology you are using. Is there any cool AI features that you have implemented, or you are hoping to implement to improve overall efficiency for your patients? Likewise, we will also talk about your big picture and big vision, where you want to go 3 years and 5 years from now on. and what challenges you are foreseeing that might cause a little bit more trouble for you in order to reach there, and what help you might need from healthcare ecosystem overall that is available out there in order for you to reach where you want to go. So this is the typical flow of conversation which we will have.
Okay. So is that what you want to know now? That all that information now?
I think we can have a dedicated call, because I think it would be great if we can have like 45-minute or so dedicated call, and we can do it in a more organized way. But if you have time right now, I would love to get started, but I am trying to be careful of your schedule as well. So as you suggest.
Okay, good. I just want to kind of know the substance. So not a problem. Well, of course, I'm Shawn James. Background, I've been in upper executive leadership management probably about 25 years. I've been a business coach and consultant for over 20 years, and so I come from the corporate background where I've kind of helped put in systems and leadership as far as the management aspect has been. Now, as time went on, obviously, I knew the technological side was very important, and so understanding processes with the technical infrastructure was really important. So trying to find that link between technology and leadership was important. And so with clients and other organizations that I was a part of, that was always the big conversation is how do we have a footprint technologically there? And so I've been the chief operations officer for a couple companies. I started in the security and law enforcement background. And so I was consulting from the government side as far as working with a private company in the government as far as consulting and finding out how to use processes that way. And then I went into the real estate part where I've done property management. So I was a regional vice president of a couple companies where I handled the operations there. And so what brought me here is my wife. My wife is Dr. Erin Harris. She has a direct primary care and functional medicine practice, which is Harris Internal and Functional Medicine, located here in Peachtree City, Georgia. And so she called me one day. We lost a business partner, and she said, "Hey, I'd really like your help to come in and run the business." And so she knew I had the background as far as running operations, and of course, she was great as a physician. And so when I came in, of course, I wanted to put some foundational pieces in place as far as a system was concerned. So this brings us to the technological part. So from my experience over the last 25 years, I'm used to platforms that integrate many different avenues into one platform. So, for instance, when I was in real estate, we would have the property management piece where we would have clients that would come to get apartments or offices. And then, of course, we had the payment and the billing and invoicing all in one. And then we would have the maintenance aspect in there also. And then we would have the demographic information that was in there also. And then we might have sales and marketing all implemented. And we might also have a communications piece where we have the texting and calling and things of that nature. When I came here to the medical side, because it was heavily dictated by the insurance industry, billing, obviously, what I realized was that it was the big medical insurance companies that were running the technological aspects of the medical system. And so what I found was, well, they were antiquated as far as how they were doing business because obviously everything was built on medical codes and, and data entry. But as medicine and technology were moving fast forward, the technology behind it was still slow behind. And that was because I found out that the insurance agency was anchoring down the technological piece. And so that's kind of what that's why you find hospitals are still having software that's 10, 15 years
10,
behind
15-year-old. Yeah.
medical practices and things of that nature. So what was different for us is that we are a membership base, so we're cash payment, and so we don't do insurance. So what was the challenge was for me to find software that catered to the cash business side of medicine. And so without all of the medical billing and all of that stuff, what was going to be a pure software that just catered to cash payments and membership based. And so it was ironic that you mentioned this, and why I was interested in this call is because I myself am in the process of building a software that does that
Right,
with AI, with the AI foundation. And so that's what I see as the big need and where the medical industry is going right
right.
now. Of course, we know that AI is playing a
Yeah.
big part of it. And of course, there's software where my wife and doctor, she's able to go ahead and be inside with a patient, talk to them, and the software is able to go ahead and distinguish between casual conversation and medical jargon. And so from there, I believe just having something that takes it to the next level is what's needed. And so what I found is if we have a software that now implements just like I did in the corporate side, but finding something that has our communication
Mm,
software that's integrated with our billing and invoicing, and then of course with medical records, that would be, and then also with prescriptions and things of that nature, that would be big. And so
big help.
that's kind of where I see that the medical industry needs to go.
You are absolutely right. You're absolutely right in pointing out that with all the advances in technology, I think the dream is that a doctor should be able to spend time with patient and not worry about documenting everything and not worrying about spending his or her time on other things like making sure everything is documented right. Okay, I have put right entries in that system. I think now we are at a point where AI and technology can take care of this administrative part, and it can give enough time to doctor to just talk to the patient and just focus on care, and everything else can be taken care by technology. I think we are definitely entering into that area where value based concept will matter more in healthcare. And I think we will be overall as a healthcare community, we will be in much better state hopefully in coming years, because I have seen that while talking to many people and many companies, there are ideas around what you are talking. There are ideas about integrating multiple components. There are ideas about using AI for speech recognition and creating documentation automatically, or using a piece of text and using that to input right code into the database inside their EMRs or EHRs and all those things. So I think we are at a age where all these things will start happening, and we all will definitely see that healthcare will improve, especially for better outcomes. So at the same time, I want to ask you one thing, because when I was reviewing what your clinic does is, and it's very close to my heart, is that you mentioned you try to solve the actual root cause. It may be nutrition, it may be any other, maybe environmental factors or something like that. So I think, again, as I was mentioning to you on the email as well, that social determinant of health, you are not, in my understanding, 100% in social determinant of health domain, but you are working in an area that is highly influenced by social determinant of health factors like, uh, for example, clean drinking water, or enough, not having enough storage for medicines and all those things. So I have also worked very closely with some of the founders, and they are creating social determinant of health system that are connecting different agencies, that are connecting different communities together, and then they are referring patients to, for example, if somebody is homeless and they feel that by providing them with better roof on their head, they can reduce a lot of burden on the medical system. So they are referring those to a community or a organization that is providing these kind of facilities. So I really got excited because you work in almost the same area where the focus is actually on solving problem for long term, actually looking at the root cause and taking care of that, instead of doing a bandage or just giving somebody a medicine and then waiting for them to show up again with something different. So I think this, what you are trying to say, if I understood correctly, is going to make a very good lasting impact on the health of patients, definitely.
Yeah, I definitely want to piggyback on what you said, and thank you for acknowledging that. Yeah, so here, of course, at our practice with my wife, she's the physician. I actually handle all the business side, but from the functional medicine side, it is finding the root cause. And again, I hear a lot of people that do criticize, of course, Western style medicine,
Right, right.
necessarily their fault because historically we just came from a time when in the early 1900s, obviously when it was the war and all of that, it was
Right.
preserving life at that time.
Mm,
So the medical schools were concentrating on just really helping you to live at that time. And then of course as time went on we started learning about different things to prolong life, but that wasn't the emphasis. And so now what I see when I run across at different functions of hundreds and hundreds of doctors is obviously the curiosity is, okay, I know I'm treating this and I'm not really solving the problem, and this kind of bothers me, and I really want to find out, well, how did we get here? Where did this root cause
right,
come from? And so of course
right.
the invention of functional medicine came, and I think that's what my wife was able to see. If you haven't met her before, she deals with vitiligo, which is an autoimmune disorder which has the patchy colors of the skin. And so I was watching a video one day that was talking about the natural supplementation of different things in the body, and just to optimize the health of the body so that it can properly heal itself. And
Right,
that ran her down the rabbit hole of looking at the root cause of like, yeah, I know there's things trying to take care of the autoimmune disease, but
right.
is there really a cure? And so then after that, she went from where she lost 80% of the color of her pigmentation to reversing that and getting back almost 85 to 90% of her
That's
pigmentation
amazing.
in less than a year's time. And so that was from the functional medicine part. And so that's kind of where we kind of move now. And a lot of doctors are now leaving from the
Traditional.
industrialized
Yeah,
institutionalized medicine and are like, hey, I really want more freedom of exploring root causes of things. And this is why the primary care model kind of works. It's not concierge where someone can just kind of name their price for the service. DPC allows people to have a really nominal price to have access, because the goal is for everyone to have access
right,
to the air. And so that's the big thing there. So we do function on a membership base, which piggies back into the technology piece. um, my imagination is, what if a doctor's able to have their headpiece on,
mm,
walking around in there with the patient, and they're describing different things and talking about their procedures and a summary of things to be able to for their care plan, be able to summarize their care plan, and it's able to print up in front of them exactly. But you're also able to update their information. You're able to take all of their vitals. You're able to go ahead and put in a message to the pharmacy. You're able to go
right,
ahead reminders for them, things of that nature. So that's really where the doctor is getting back to the nature of serving and not really worrying about being bogged down with the administrative part. And so allows for a lot of micro practices to grow, that also allow more independence for the physician, and also for better quality care, because I see that they're bogged down almost half the time of the day trying to do documentation.
right,
So
right. Yeah, absolutely. I think again, it's honestly, I believe this will be easier challenge for technology to solve, especially on the documentation side, and then inputting right uh, piece of conversation to the right component of the software. So, for example, if you are using EMR, okay, here the symptoms should go from the conversation, here the prescription should go, and all those things. I think it's going to be relatively easier use case for AI. And but I am really impressed with your experience and understanding of integrations as well from real estate to healthcare. And I was laughing when you said that healthcare is a different animal when it comes to integrations, because there is a lot of different hoops here. There are many regulations you need to go through. Some of them make sense, some of them may not make sense
Yeah.
a whole lot. But I think again, if technology can help us taking this documentation piece off our plate, and at the same time, if integrations are easy, I think that integration, there are two layers of integration. One is that you really need right permissions, you need right protocols, you need right approvals, and the second is using the right technology to integrate, because as you were saying that majority of our healthcare systems are 10 years old, and it really becomes difficult if you have to integrate those with any recent components. So the second challenge is using the right engineering approaches to integrate all those components together. For example, a system that takes vitals, so that system might be built in early 2000s, and it may not be compatible with the modern EMRs or modern PHRs. So again, that's the second challenge, but that one is easier to solve as compared to going through security approvals, going through all sort of regulatory requirements and need. So of course, the reason for conversation like that is to create more and more awareness of the challenges that may not be 100% in yours or mine control. But if we make a lot of noise for that, if we make a lot of awareness for that, this will reach out to the right individuals, and we can hope for better outcomes on them.
Yeah, I totally agree. Again, coming from different industries, I don't believe it'd be quite that hard, because we already have the different,
Yeah,
platforms out there. We have Spruce that does, secure messaging. We have Elation. We have, all these different things. The issue is that we just haven't tied them together to work. So even from a cost standpoint, I mean, when I look at the individual physician that goes out and starts a practice, and then they have 5 to 6 different subscriptions to different platforms, that is anywhere from an extra $1,000 to $2,000 a month, and
yeah,
so that's just able to use those different things. And then of course, if one piece of that goes down, it does affect the other part. But now you don't have support, here that's the same level of support on this side
right,
in that part. And so, making the attempt to start creating, it's like anything else. If we take the ball and run with it and just make a prototype of a
right,
platform, especially with
right,
AI and the chat bots and all of that other stuff that we're already implementing, if we tie that together and just start working the kinks out,
right,
you'll
right,
find out that, hey, this can help. And of course, HIPAA compliancy is definitely part of the background. But once we get that part taken care of and have a whole secured network, I
right.
mean, we should be able to solve that problem. And so that's just kind of how I'm looking at it.
Yep, yep, absolutely. And I think, as you said, HIPAA, there might be, again, we just have to be careful, because there might be a lot of solutions out there, but it's not sure if they are HIPAA compliant or not, or how exactly they store data. So it is also a matter of being little bit vigilant as well about what to adopt and what not to adopt, because of course we also have this big moral responsibility of protecting our patients' data as well, making sure that it's saved, stored, and all the right approaches are being followed. So, Sean, I'm really enjoying conversation with you, and I
Yeah,
know
thank
we
you
have a
very
lot
much.
we have a lot to talk. So, I just want to understand your big vision, big picture, where you want to be in 3 years, 5 years. I understand one piece that you want to leverage technology more and more to see how you can offload a lot of administrative burden. But overall, from your clinic side, what exactly is your big vision for next 4 year, 5 years?
Yeah, as we start seeing, the the attitude for information in the medical world, we're finding out that people want to know more. They want to live more holistically because we're now understanding. We even see that in Washington D.C. with JFK, who's working to try to change certain things in the environment, and so we find out that we are. An obese society. We also have
Yeah,
heavy
gotcha.
toxins and things of that nature. So what the vision is for people to have a better relationship with trusting the doctor and being able to implement holistic procedures that is going to, prolong life, basically, but not overburden the doctor. Our healthcare system is overburdened, and so using technology and finding root cause, I believe, will not only alleviate the workload of the doctor, but also help the everyday person become more educated and prolong life here in the West and around the world also. And so that's kind of the vision that we have there is that with direct primary care, that's just a form
Right,
of accepting medical care in that regards. And so, of course, obviously, a lot of people are trying to, have it for free, but obviously, the system isn't quite built like that. But we're getting closer with legislation and processes to reach that goal. And so that's what we're excited about. Not just myself, but other direct primary care physicians
right.
around the country, and the rise of functional medicine. Also, I believe that's going to really take hold over the next 5 years, where you're going to see more and more people who really want to know the root cause, because we're seeing the rise of naturopaths and other people in that field start to come. And then you'll see more integration of that, which we're starting to see from chiropractors and
Yeah,
BGs and all of those different sectors. And so I think that's what I'm excited about.
that's great. That's great. That's uh, that's really optimistic, and definitely, I think we are on that track. Uh, I want to ask you, Sean, how big is your team right now? How many people you are working with, and um, for you, manpower is also an issue, or you feel that you are in a good spot with respect to that?
Yeah, we currently we have one main practice, and so we have five full-time employees, and we service over 500 patients in our panel. And so with direct primary care, it allows us to be able to service that many people. And from there, I mean, we could probably go up to about 700 still, kind of comfortably there. Are looking for other physicians, and so
Of course.
that functional medicine and primary care philosophy. And so we're always looking to expand, and we're looking over the next year or two to expand in a couple other locations also. And so that's kind of where we are right now.
Great. Right. I mean, it's great with the number of team members you have. It seems like it's a very optimized team, high performance team, definitely. And you have probably managed their bandwidth well that they can still cater to a good additional percentage of patients as well. So that's really impressive. And I think if I want to ask you, I mean, you have a lot of experience in operations, more importantly, for somebody like who is starting right now and who is trying to build their own company or who is trying to build their own practice closer to what you have, what advice would you like to give them? Looking at hindsight, all the learning you have done. So, if you have to share a piece of advice with somebody who's just starting right now, what that would be?
Absolutely. The first thing I always recommend is find a mentor. Find a physician that is doing what it is that you like to do, and spend time with them. Have lunch with them. Sit down, ask questions. Spend a few days in their practice to kind of see how things function, so that you get realistic viewpoint of what it is that you're looking forward to do. I always recommend that. Again, from the corporate world, that's what we're kind of used to. In the medical world, I know it's a little different. People just start their practice, but
Right.
to kind of cut down on the headache in the beginning, that's the first thing I would suggest is find a mentor or a business to model, and then try to put time there to kind of look and see that operation. The second thing is to start small. Starting part time, whether it's 1 or 2 days a week, and still carrying a full time job. That's how I would always recommend. Don't start getting this big space, spending all this money on new
right,
furniture and new equipment and all that. There's nothing wrong with with starting with a room that you can rent, maybe a room
right,
or at least a room
right,
in a practice already, somewhere there. Go ahead and start with getting used furniture, used equipment. Nothing wrong with that. There's practices that open and close, and you'll
uh,
find great deals. So, what I always say is start off very small and then learn to do the processes of the practice. I understand a lot of doctors don't have the business part down pat, but they have service and are great as far as servicing the patient. But that's where you really get to learn. My wife in the beginning, she was the everything. She was the one who answered the phone. She was the one that took the vitals. She was the one that did the charting. She did everything in regards to that. And so that allowed her that when she was ready to expand, she knew exactly what was expected from
right,
the employees that she brought on. And then when it's time to bring on help, I definitely say look at either interns, look at a virtual assistant, look at someone very, very part-time to do. And that can have multiple skill sets, not just answer phones, but answer the phones, and maybe they're a CNA, or maybe they're an RN, or someone who like to work part-time where they can draw blood or do labs or do something also, so that it takes the burden off of you, so that allows you to do your craft and allows you to expand and get to build your panel up and still do it at a very affordable price. So these are just some of the things that we definitely found along the way to help you grow into that. And so at different stages, obviously you'll find needs. And then when you feel the need, when you feel that as a physician that you're kind of heavy, top heavy as far as work and time, that's when you would bring on another person once
right,
that's maxed out. A lot of people will bring them on too early, and then they have this rubber band effect of costs, and
right,
that can be very, very stressful. So I tell people just wait until the need is really there. Let's say you grow on a panel of 50 to 100, and you already have maybe a part-time person. Look at maybe bringing that person full-time, and again they have many skills, and then maybe bring another part-time, maybe a part-time nurse or something of that nature till it grows more.
grows, yeah,
So
yeah,
yeah, that's it. Just kind of
yeah,
move steady. It will definitely grow.
very
And
good,
you have to market, and so that's
yeah,
where it's really hard. There's a lot of marketing that needs to go on,
right, right.
doing learns and social media and showing up and just talking to other physicians around the area to let them know that you're around. Yeah. So
I think again, that's the great pieces of advice, honestly. And I think, as you said, um, to your last point, I think it is very important for founders to come up with authenticity. I mean, if they are they're working in any area, they really, really need to show to the community that they care for that, and they cannot pretend it. They have to become that person which they are trying to showcase. And at the same time, I was talking to somebody a few days ago, and he mentioned an interesting thing which really stayed with me, that he said that thoughtless expansion has killed more companies than challenges. And I
yeah,
think that's what you was also trying to say, that don't get a big space all of a sudden. Don't hire a lot of people. Try to grow small. Try to get things under control, and then see how everything is working, and then try to expand accordingly. So I think this is a common mistake which a lot of founders do, is because they are definitely excited. They want to grow fast. They want to become a success story. But on that journey, they kind of end up doing a lot of thoughtless expansion, and each decision you do adds to your monthly expenses, and eventually that unfortunately puts companies in a very deep hole. So yeah,
yes.
these are all great piece of advices, and I think people who will be listening to this will definitely love this piece of advice from you, that slow and steady, but you will definitely reach where you want to be.
Absolutely, absolutely.
So thank you so much, Sean. I think we had a great conversation.
Well, thank you.
And
I'm glad I could contribute something. So
yeah,
thank you for the time.
and do you have anything, any question, anything you want to ask? Please feel free to do.
No, I'm pretty good. I appreciate everything that
Thank you.
that you're presenting. I'm just excited to kind of see this come together.
And it was great talking to you. And I would love to be connected with you to learn more and more about what you are doing and see the future for Harris, and hopefully what
So,
you are envisioning. I will pray that it happens sooner than you hope.
well, thank you. I appreciate it. We're friends now, so you can reach out
Yeah,
to me anytime. Okay.
absolutely, absolutely. And thank you so much again. Have a great day. Thank you so much.
Thank you.
Thank you. Bye bye.